Hello and welcome to Season 2, Episode 9 of Conversations, a production of the Oakville Chamber of Commerce. Today is Wednesday, February 3rd, and my name is Tim Cadigan. Conversations is a current event show where we engage business, community, and political leaders and get their perspective on what is going on in our community, across the country, and around the globe. My guest today is Dr. Hamida Maghani, the Medical Officer of Health and Commissioner for the Halton Region Health Department. Dr. Maghani is a public and preventative medicine physician and a fellow with the Royal College of Physicians and Surgeons. Dr. Maghani has a master's in public health in family and reproductive health and a master's in management health leadership. She joined Halton Region from the city of Hamilton in 2014. Dr. Maghani is passionate about public health, prevention of illness, and increasing health equity. As Halton's Medical Officer of Health, she is deeply committed to keeping all residents safe and working with partners to create an environment that fosters good health. Welcome to the program, Dr. Maghani.
Thank you so much, Tim.
I'm wondering if we can start our conversation by sharing just a bit of information about the role of the region's Medical Officer of Health and how that role might have changed over the last 11 months.
Certainly. So my role is actually a legislated role. Most people in this province would not recognize that. And I think over the course of the pandemic have learned a lot about medical officers of health and local public health and how they're situated in the context of Ontario's health system. So for local medical officers of health, we require a certain amount of training, and that is, beyond what, let's say, your normal family doctor would have trained as. And then we have to be appointed by not only our local board of health, which in the case of Halton Region is the Halton Regional Council, but also by the Minister of Health. So we go through quite a rigorous process to get ourselves into these positions. And pre-pandemic, I would say, we do a lot. So from the perspective of communicable diseases, such as what we're experiencing now with the pandemic, we are very much involved in ensuring that communicable diseases are kept at a minimum. We do a lot of case and contact management for a variety of diseases, for instance, whooping cough or pertussis, tuberculosis, many other diseases. But that's just the very tip of the iceberg when it comes to public health work. We do a lot of things in the background that most people don't even realize we're doing. So, what's probably most of interest to our business community, for instance, is that they may notice public health inspectors if they're in the food premise business, so our restaurants and such facilities, but also with personal care settings. So we're talking about nail salons, hair salons, etc. We visit all of these facilities or locations on a regular basis, do our inspections, provide guidance to business owners on how they can operate more safely, and make sure that they are following public health direction. So that's one piece that business owners may be well aware of. And then there is a lot of other things that we do in our community. And if you never hear about public health, it means things are going fairly well in your community. We make sure that your water is clean. And if there is an adverse event with your water, I get directly involved. I have to make decisions around things like whether to issue a community a boil water advisory or a drinking water advisory. We do a lot of programming for vulnerable families that are at risk due to social determinants of health. We conduct parenting programs. We work very closely with our school boards. So a lot of things at that population level that most people don't hear about. And so that is the type of work that we were doing before the pandemic. We are trying to do a little bit of that work during the pandemic, but it has become extremely difficult given the resources that we have are pretty much deployed to our response to COVID-19. And so there are a lot of things that won't get done in our community as a result. It's not like a surgical wait list where people just end up waiting an extra year or two to get their surgery done. The work that public health does and is unable to do during the pandemic, will never get done, and it will have consequences for our population in the long term. So I hope that gives you a flavor of what my role is in leading the public health department.
It does. It's a very broad mandate. It's interesting. If you Google public health and look back just before the pandemic, the big discussion was around amalgamation of public health units. What's your take on where we were heading a year ago and where we are now? And does that have anything, do we worry about the funding of public health?
I absolutely do worry about where public health is going. Certainly in 2019, we were at a point where there was a lot of anxiety for local public health units and the overall public health system here in Ontario. The provincial government was making plans for possible amalgamations, definitely some cuts to our budgets, and I want to put things into perspective. At least since I've been in this job, since 2014, we have not had any money, any additional funding for public health. So we have been pretty much flatlined since 2014, with perhaps a little bit of budget dollars being thrown our way, but for new programs that we were expected to put together. So not for the fast growing population that we have here in Halton. And so we've had to do without for a long period of time. And then in 2019, certainly there was a lot of anxiety because municipalities were being asked to take a bigger share of the public health budget from the province, and also that we really just didn't know what the structure of public health was going to be. So in that context, we entered 2020, the year that the pandemic started, and it certainly has been challenging because of all of the issues in 2019. Despite all of that, I'm very proud of what local public health here in Halton and elsewhere has been able to accomplish during the pandemic. We have worked really hard to try to resource our departments, use innovative ways to do our work, and pivot very quickly in an ever evolving situation during the pandemic to do the work that only we can do in public health.
There's lots of things we've learned coming out of the pandemic, and I think it's probably a case study that might argue against amalgamation of public health. If you look at how our region versus some of the neighboring regions have done, clearly, if they were under one umbrella, this might have been a very difficult or different situation. What sort of interactions do you have with the other area medical officer of health?
We have really great relationships, Tim. I'm so glad that you've asked about this. We have regular dialogue amongst ourselves, and sometimes that's at a regional level. So, for instance, I'm in regular dialogue with the medical officers of health in the Greater Toronto Hamilton area, and then we often have discussions at a provincial level with all medical officers of health, the 34 of us. And these conversations are very supportive. We share information. We try to troubleshoot, and we try to be as consistent as we possibly can be in our decision making. But I know that the public sometimes is concerned about how we make decisions, and that they see something happening in one region and something else happening in a different region. And so, what I will, try to frame for you is that this is like a good doctor who does their homework on their individual patient. So, I'm the doctor for the Halton community. I certainly try to, incorporate the science that is coming out at us, but at the same time, I also have, and the public health department has a unique view and lens on the Halton community specifically. So taking into the perspective of the local context is very important. And that's why sometimes you'll see public health programming differ from region to region to meet the local needs of our own individual communities. And that's sometimes where you'll see us making different decisions, even in the context of a pandemic, because of what's happening locally. And obviously, we've seen here in Halton that at different times of the pandemic, we've had a different situation than our neighboring regions. And that's because our local populations can be very different from each other.
I want to get a little bit more in depth onto the pandemic, but first, can you give me the simplest layman's explanation of what a virus is?
That's a great question, and I knew you were going to ask me that question. So, as simple as we can be, they're very tiny parasites, much smaller than bacteria. So, for those of you who might remember from your grade 10 biology days, that we have, all of these other living organisms at play besides us as human beings. And so we talk about bacteria, we talk about viruses. So viruses are much smaller than bacteria. And what they do is they infect us and they use our cells to reproduce themselves. And then they go on to infect more and more cells within our body. And that's what ends up causing disease. So for coronaviruses in particular, the main way that this virus is spread is that it infects one human being, and then through our respiratory droplets, uh, the viruses are in our respiratory droplets and can then affect another human being that is close by to us. And that's why avoiding close contact with people outside your household is so very important, because these respiratory droplets, it's not just about coughing and sneezing, it's about how you talk, and the droplets are coming out. They're invisible, they're in the air, and that's why, wearing a mask is so important. That's why physical distancing is so important.
That helps. I think we wait with bated breath at every announcement that comes out about what the next restriction might be about the pandemic or when those restrictions will be lifted. What input do you get to decisions that affect us regionally?
Yeah, so at different points in time, we local medical officers of health have been consulted by the chief medical officer of health on what we see as our local context. Generally speaking, a lot of it is numbers based, right? We look at our case counts, we look at the trending of our case counts, but sometimes, again, that local context is so important. So the chief medical officer of health or other members of the Ministry of Health may be asking us questions about our local situation. What are the populations that are being most affected? And that, again, can differ from community to community. At some points in time, we're talking about how much this is impacting our long-term care homes and retirement homes. At other times, we are looking at how this is impacting essential workers and workplaces and the number of outbreaks that we have. So, this is ongoing. We provide the ministry with information. In fact, there's a daily report that goes to the ministry, not just on the number of cases, but also on the trends that we're starting to see, the emerging issues that we are facing locally. And there is a lot of information sharing that happens with the ministry. And at the end of the day, the province has to make some very difficult decisions. I do not envy for one moment the decisions that they have had to make throughout the course of the pandemic. These are not easy decisions, and even locally, the decisions I make are not easy decisions. It's not just about health. I am looking at economics, because we know that income is a huge social determinant of health. So absolutely, when we're making these decisions, we are thinking very broadly about the health of our community and all of the different factors involved in making up health.
You're watching Conversations, a production of the Oakville Chamber of Commerce, and today I am joined by Dr. Magani, the Medical Officer of Health and Commissioner for the Halton Region Health Department. Dr. Magani, our numbers in Halton have been a bit lower throughout the pandemic than some of the neighboring regions, and you touched a little bit about how we look at demographics and the specifics to the region. But what else can you attribute those results to?
So I would say a large part of it is probably related to demographics. What we see is that we have a more affluent community in general living in Halton. That's not to say that we don't have people of varying income levels living here. We know that that exists, and we know that there are inequities in our society. They're just perhaps not as visible as they are in other regions of Ontario. So I would attribute the fact that we have that more affluent community, people who are perhaps able to work from home more easily. Whereas I think in neighboring health units, when you look at the population in Peel and in Hamilton, it is a community that is made up much more so of essential workers who cannot work from home, unfortunately. So I think that's definitely been a factor in our lower case counts compared to other regions. There's another big factor is the number of people per household. So you'll see that, for instance, in Milton, specifically, we've had some higher levels of COVID in that community. And that's because once you introduce COVID into a house, it is very, very difficult to stop the spread within a household. And we know that in Milton in particular, but certainly there are cases of this in other parts of Halton, where there are larger households. There are multi-generational families living together, or multiple families living under the same household. And so then we see much more COVID spread in those communities, and that is certainly another factor.
So based on that, and when you hear stories about multi-generation households, in most cases it's economics and people having to work at various shifts and jobs and that sort of thing. What role does the business community play in helping to keep everyone safe?
That's a fantastic question, Tim. I think the business community has a huge role to play in keeping their workers, their frontline workers, or the workers that are, having to work in person, uh, very safe. So from day one, we've tried to provide resources when we could. I have to say, though, early in the pandemic, I think the business community did have to do a lot of things on their own. They had to take bits and pieces of information and put together what they could in terms of safety measures in place. But we have seen a lot of guidance documents, a lot of direction coming out of the province, and certainly here in Halton, we've created a lot of resources for our business community to assist them with helping to make sure that they're keeping their employees as safe as possible. And one of the biggest things is really, the day-to-day screening. So before an employee arrives at work, preferably, or when they arrive at work, they really should be asked those questions about how they're feeling, about if they've had any contact with individuals with known COVID, et cetera, before being allowed to work that day. So I do feel that for the most part, our workplaces have been doing a very good job with respect to all of the different safety measures. And certainly when there have been cases of employees in workplaces, we have tried very much so to support those workplaces. Workplaces have been open and transparent with us, very cooperative. I would say most of the time we've had nothing but cooperation with our workplaces, and managers and owners of businesses have wanted to do the right thing, which is to keep their employees safe, keep their customers safe, and so it's a partnership that is ongoing. So I would say that there's lots of work still ahead because the pandemic is not stopping anytime soon, and the business community still has a lot to put together. But they've done an incredible job so far, and we hope that that will continue over the next several months.
And we've seen not an escalation, an increase in the number of inspections going on with businesses. But what are public health officers looking for when they inspect businesses?
There's lots of things. So we look for, plans to be in place, safety plans to be in place at each and every business. We look for things like physical distancing, hand hygiene to be available to all staff, that meal breaks and things like that are staggered between employees, and there's lots of physical distancing in place for when employees are in one space and eating a meal, because that is one of the ways that COVID can spread. You have to take off your mask when you're eating a meal, and certainly masking within a facility is another key measure that we're looking for. So all of these types of things are being looked at when it's either the public health inspectors, bylaw officers, or Ministry of Labor inspectors that are coming in. Simple things, but unique in each workplace, because depending on the layout and the type of work that is being done in each workplace, there may be some nuances, and that's where our inspectors are looking to provide the best advice to our workplaces to do better.
I think the role you play is crucial. We've had a number of public officials on, and I can't help but think what the past year has been for all of you, based on just the constant level of stress that you and your team have been under. How are you doing? How's your team doing?
Well, thanks so much for asking. I think it's been the most challenging year of many of us, our lives. Certainly for me, it has been an extremely challenging year, both professionally and personally. But when I think about the hardship that many others in our community are undergoing, I think of myself as very lucky. I'm still able to work while I don't work. I don't have to work in person. I can stay at home and work for the most part from home. I have a steady paycheck. I am not worried about, paying for meals for my family and such things. So I worry about the people who are undergoing those hardships. And whenever I have a problem or a challenge to encounter, I try to look at what else is going on in our community, and thinking from people's perspective. Most recently, our the parents in our region have undergone a lot of hardship because of the suspension of in-person learning, and I'm hearing from them constantly. So for those of you who are viewing this show today, I will say that I've received your messages. I'm not necessarily able to get back to each and every one of you, but I hear you loud and clear. I am a parent too, not just a medical officer of health, and I hear you. It has been very difficult, but we all have a role to play, and we all have had to make a lot of sacrifices throughout this pandemic. So I think we just need to think and put ourselves in other people's shoes, other people who are not as fortunate as us when it comes to the economic hardships that have been dealt through the pandemic. And certainly our business community is part of that group. I certainly do appreciate not just the amount of work that they've had to go through, but the anxiety that they've had to endure as a result of the pandemic, not knowing whether their business is going to survive this. And I truly hope that everyone's businesses are surviving, and if not, that we will come out of this, and new businesses will come online. But I do understand that, and so for me, I try to take that perspective, Tim. Yes, struggling is part of human life, and this year has been the biggest struggle for us, but better times are ahead.
I think through the pandemic, it's obvious that there will be lots of lessons learned, lots of data collected, and hopefully we'll have lots of time to really go through that and prepare better for whatever comes next. But I want to ask at this point, 11 months in to this pandemic, what are the lessons you've learned as the region's medical officer of health?
So, lots of lessons. I think the pandemic's really highlighted or put a spotlight on issues such as mental health, inequities in our society, and for me personally and professionally, the importance of having a well-equipped public health system here in Ontario. It's really been through our collective efforts, not individual and then collective, everyone doing their part, that we've been able to manage this pandemic, that we've tried to keep our hospital resources protected and limit the number of deaths due to COVID-19. Um, so we need to keep on with that, but I think that we have, by being apart, we've been stronger together, if I can use those words. From a mental health perspective, I think with so many restrictions in place that are affecting our day-to-day life, people have learned what's really important to them and what supports their mental health and well-being. And so now more than ever, I think access to mental health supports are fundamental to the health of our community. And we've been trying to do what we can with our limited resources, but I know that people have been innovative and really um, spent some time throughout this pandemic reflecting on their mental health. And when I talk about mental health, I'm not talking about mental illness. I'm talking about how to keep strong mentally, emotionally, physically, and people have really found their path, hopefully. And where they're still struggling, there's lots of resources available. And finally, on the inequities issue, I will say that I think what we've seen is that unfortunately, income inequities are a huge challenge in our community. And when something like COVID presents itself, it will create even more inequity in our society. So what we're seeing is, for example, it's important for essential workers that we add not only as many infection prevention control measures in place at their workplaces to protect them and protect our entire community, but that we also have policies in place that support their health. So there's agreement amongst medical officers of health in Ontario, but also with many local politicians that paid sick leave is absolutely essential. Low income workers are risking their lives by going to work day in and day out. And we need to make sure that we're providing them with the right supports to stay home when they're ill. People shouldn't have to make decisions about putting food on their tables versus infecting their colleagues at work.
It's hard to think of anything positive to come out of a pandemic. It's been hard, as you said, on so many, really everybody. But what coming out of the pandemic, or I guess we're not coming out of it yet. At this point in the pandemic, are there any positives you can take coming out of it? Were there things that we were prepared for, as much as you can prepare for this type of situation?
I think we've learned so much over the course of the pandemic that when we finally have some time to reflect on all of our learnings, that we're going to see that we've evolved in terms of the type of work that we've been able to accomplish in so little time. The pace of the pandemic, the amount of work that we've had to do in the last 1 year is phenomenal. And so I think there's a lot of learnings from that. There's a lot of learnings related to what we just talked about in terms of inequities, and I actually think that we will come out of this stronger. Our society will be stronger, and the light that has been shone on the inequities amongst people in our province will lead to better efforts, both at a government level, at a business level, and throughout our civic society. I think there's going to be a lot of wonderful things coming out of the pandemic. I will say that one of the biggest things that has come out is our ability to work from home, to use technology in a very real way. And within the healthcare system, more and more providers, primary care providers, and other providers are now able to use virtual care as a strong platform of delivering care, and that actually can make them much more efficient. It can make our whole system much more efficient. So I think there's a lot of wonderful things that have come out of the pandemic and are going to continue coming out of the pandemic.
That's a great note to leave it on. That's all the time we have. Thank you very much for your time today, Dr. Megani, and thank you to your team and for you for everything you do.
Thanks so much, Tim, and thanks for having me on.
That's all for this week. We'll see you next time.